Hello, my name is Sam Summers. I am a professor and the chair of the Department of Psychology at Tufts, and it is my great pleasure to welcome you today to this webinar sponsored by the Office of Alumni Relations at Tufts. The name of our webinar is COVID-19 and Mental Health, Taking Care of Yourself, Your Family, and Coping with the New Normal. And so my job here is very limited, and it was to welcome you and to then introduce the individuals who are generously sharing their time with us for this webinar. And so let me do that without any further delay. I'm pleased to introduce first Dr. Sharon Jedel. Dr. Jedel is a 1996 alumna and is a clinical psychologist and associate professor at Rush University Medical Center in Chicago, Division of Digestive Diseases. She provides psychotherapy to patients presenting with gastrointestinal symptoms, as well as anxiety, depression, or trauma. In response to the COVID-19 pandemic, Dr. Jedel joined the Wellness Response Team, a multidisciplinary group who rounds on the hospital's COVID-19 units and checked on the mental health of doctors and nurses. She also has a private practice. I'm also pleased to introduce to you Dr. Shara Brofman, a 2005 alumna and a licensed clinical psychologist in the greater New York City area, specializing in adult psychology and reproductive mental health. She earned a bachelor's degree in child development and Spanish at Tufts, and a doctoral degree in clinical psychology from Rutgers University. In addition to her clinical work, Dr. Brofman has taught at Teachers College, Columbia University, and is an active member of the American Society for Reproductive Medicine and a number of other professional organizations. I'm also pleased to introduce to you my colleague, Dr. Eileen Crehan, a clinical psychologist and assistant professor in the Child Study and Human Development Department at Tufts. Along with its students in the Crehan Lab, she seeks to understand how autistic adolescents and adults can achieve best outcomes. Her current projects include disseminating sexuality and relationship education programming for autistic teens, testing provider trainings related to autism, and exploring patterns of IEP services for autistic students across the country. And then finally, it is my pleasure to introduce to you my departmental colleague and our host and moderator for today's webinar, and that's Dr. Alex Queen. Dr. Queen is a full-time lecturer in the psychology department at Tufts. He is also a licensed clinical psychologist in private practice, specializing in anxiety and mood disorders. He received his undergraduate degree from the University of North Carolina at Chapel Hill and his PhD in clinical psychology from the University of Miami. Dr. Queen is also the parent of two daughters, ages 6 and 8, and so he is gaining firsthand experience right now in navigating the reopening of schools and remote learning this fall. And so without any further ado, once again, thank you all for joining us, and thank you, of course, to the Office of Alumni Relations at Tufts for sponsoring this webinar. And it's my pleasure to turn things over to Dr. Alex Queen. So Dr. Queen, take it from here.
All right, thanks so much. Okay, so, the topic for today is COVID-19 and mental health and how to kind of deal with a lot of the difficulties that this pandemic is presenting for us and our loved ones and our family members. So I guess we can just start off talking about some of the, the main mental health difficulties that people are experiencing. Just looking at some of the recent research that's been done, about 6 in 10 Americans say that they've experienced some kind of strong negative emotion within the past week, whether that be anxiety, frustration, anger, sadness. There's also some evidence that we're seeing in particular groups, young adults, racial and ethnic minorities, essential workers, and caregivers, that they're experiencing some particularly difficult mental health outcomes right now, in particular anxiety disorders, substance use, increase in suicidal ideation. I guess I'll start with Shara and Sharon. What are some of the things that you're noticing with patients that you're working with in your practices? So Sharon, would you like to tell us some of the things you're noticing?
Yeah, sure. First of all, thank you so much for having me. It's really a pleasure to be here. So I really think about what's going on with my work and my practice in sort of two ways. In the very beginning, when the pandemic was first starting, at least in the US, and then now. Now I'm seeing a lot more anxiety about returning to work, whether or not one's children are going back to school or being at home. A lot more anger now regarding where at least things are within the US relative to where we could have been. And certainly a lot more feelings of despair. Whereas in the beginning, in the first couple of months when we were sort of going into lockdown, there was certainly a lot of anxiety about getting COVID, about being home for an indefinite period. But there wasn't the anger that I'm witnessing now. There certainly wasn't the despair or the hopelessness because it was still so new. And there was actually a lot more gratitude early on because I think a lot of people were feeling that this had provided them with some very unique opportunities to spend more time than normal with loved ones, with their children. And so there's really been a shift away from, I think, a lot of positive emotions, unfortunately, and really a lot more anger and anxiety about reintegration, so to speak, as well as anxiety just about everything reopening and how we're going to sort of cope in this new normal.
And Shara, what about you? Are you noticing similar things with the people that you're working with?
Sure, absolutely. I want to also, express my appreciation for having me here too. It's a pleasure. I like very much, Sharon brings up sort of this developmental perspective. I think hopefully maybe someday somebody will do there'll be more data, or somebody could even do a dissertation on this topic in terms of thinking of this whole experience in sort of a phased way, and that there are different kinds of experience, kinds of emotional experiences that people are having. I learned at Tufts to think developmentally over time, right? So there may be kind of different experiences people are having over time. I find myself feeling often that it's appropriate to make comparisons sometimes to the literature on grief counseling, and kind of, the amount of, for some people, both trauma and loss, for some people more along the lines of loss, but these ideas of lost time, lost experiences that we can't do. I mean, wouldn't it be great to all be in a small room together right now doing this panel, right? So different kinds of experiences that we can't do right now, or ways of coping. A lot of people have said, there are things that I used to do to cope with these difficult kinds of feelings that I can't do now. I can't easily get together with friends in person. I can't maybe go to an exercise class, or all of these things that we might have coping strategies on which we might have relied in the past, to which we don't have access as easily now. And so, helping people to think of creative ways of managing deep uncertainty. The thing about, if we want to make the comparison to a grief process, if someone has lived and died, and then we're working with someone to kind of heal from, move forward with that experience, there's sort of an end after which we're sort of moving forward. And I think what's very difficult for people to conceptualize is that this is ongoing and changing, and to have the flexibility, sort of lack of cohesive structure to be able to make plans. A lot of people say, well, I'm used to making plans, or I'm used to problem solving in such a way, and that no longer works. And so there's certainly a lot of anxiety and frustration, anger, around not knowing what things are going to look like.
Shara, you just mentioned, a really important point, which is that a lot of people, their go-to coping mechanisms may no longer be available right now. Mm-hmm. So I guess we can use that to go to the question, how can people cope right now? What are some of the, in a healthy and an adaptive way, what are some of the recommendations, that you're giving to your patients? So Shara, we'll start with you.
Sure. I think it's important to kind of remind people, this whole experience is people are often using the term unprecedented, that we don't have a template from which we can say, okay, in the last pandemic, in the last global pandemic, you know, sort of this is what worked for me. We don't have evidence that we kind of can get through it. And so I think often the stressor or the complexity of all of the different stressors involved here are new. And yet I often encourage people to consider that they're not really at square one with how to cope. There are things that we may need to sort of adjust, but that, you know, to try to understand what works individual, you know, there are individual differences with what helps people to cope through adversity. And so what helps you in the, you know, does connection with people help you? In which case, you know, are there creative ways in which you can remain connected to people? As Sharon pointed out, there have been, it's not the same, but there have been, in fact, I think, increased opportunities to remain connected, even if not in person. But the literature which you cited, Alex, I remember, you know, mentioned that people, in fact, are often, you know, maybe more in touch over text or email or in digital ways over Zoom. Now we know that it's sort of, it could be the norm now that we, you know, have these video chats with international family, or, you know, where maybe we wouldn't have before, or so there are increased ways to kind of, it takes, I think it takes more work. So I think to remain connected, if that's what helps you, if exercise helps you, and that's, you know, you can do that in some sort of a, even if it's in a limited way, whatever you know, starting really small. I often sort of almost apologize speaking with patients and say, you know, this might sound very concrete, but can we start small and think about what helped you in the past and how that might map onto your current circumstances. Healthy, you know, really simple things like healthy behaviors around eating and sleep and staying in touch with people, or what's meaningful to you, even if it might take kind of added work these days.
Right. Okay. Sharon, what about you?
So I would start out by mentioning a phrase that just came up when we were all talking before the webinar began. Insofar as many of the emotions that people are having, be it anger, despair, depression, anxiety, are normal reactions to an abnormal situation. And so I think that what's very important is, first and foremost, that people learn to accept and tolerate the fact that they are going to be feeling angry or anxious or depressed or sad or hopeless during this period. I think it would be very unrealistic to expect otherwise, right? This is, like we're seeing and like everyone's saying, unprecedented. For many, it's been highly traumatic. Certainly for everyone, it's been very stressful. And so I think this idea of, I think we would be approaching it incorrectly if we tried to get rid of any of the negative feelings. And I think first, it's important to expect that we're going to have more anxiety or more anger, to work toward tolerating that, and then to, if possible, self-monitor these emotions. When and if they begin to interfere with our daily activities, if our anxiety or anger starts causing us to have sleep problem, as some people are, or increased physical symptoms like headaches, if we find that anxiety or anger is interfering with our daily activities or with our interactions with friends, then it may be time to think about modifying how we are coping. And I certainly echo what Shara said in terms of finding what coping mechanism works ideally, but of course also maintaining, you know, good night's sleep, exercise, good nutrition, connection with others, whether in person in a socially distant way or whether online. I'm a big fan of meditation, and many of my patients rely on an app called Headspace that they really enjoy and find very beneficial. I think that I would also emphasize one way of not coping effectively would be over-engaging in social media. I think in the beginning, all of us, myself included, were constantly monitoring the numbers and the number of cases in our particular city or state. And what I've talked to patients about is that, really trying to decrease this sometimes addiction to the social media and news around COVID, I think is very, very important and helpful in terms of anxiety.
Okay, great. Yeah, it is definitely difficult in this 24-hour news cycle to disengage from that. That's a really good point. So, Sharon, you were just mentioning, both of you actually mentioning very good kind of recommendations of coping skills that people can use. Let's say someone they're just really struggling and some of their coping skills are either not effective or they're still experiencing a lot of really negative emotions. I mean, what are some options available right now for kind of mental health care, especially given the pandemic, in terms of how it's being used and maybe your experiences with telehealth? Maybe we could just spend a few minutes talking about those. So Sharon, if you want to start.
Yeah, so maybe one of the positives of the pandemic right now is that psychotherapy is so much more readily available, really to the whole population, provided that they have either a telephone or a computer with internet access. So in my practice, I would say that I see between 30 and 40 patients a week. 95% of them are either via a similar platform, such as called WebEx, or by phone. 5% are in person. It's very, very different. I very much miss seeing my patients in person. I miss the connection that takes place within the room. When we're in person, we're masked, of course, and so that presents its own challenge in terms of body language and facial expressions. And when we're doing it like this, via Zoom or even on the phone, that too presents a number of challenges in terms of connection. But thankfully, psychotherapy is, widely available now during this pandemic. And so I think that for somebody who finds that their typical coping mechanisms are not effective or not effective enough, insurance plans are fully on board with telehealth, with telemedicine. And so there is an opportunity to get help remotely. And I encourage anyone to do so if necessary.
Shara, what would you?
Sure, I think what I might add, a lot of insurance. So if people have health insurance, a lot of health insurance panels are waiving, in fact, copays for telehealth. There are some issues state to state, and so often, for the most part, patients are needing to see providers that are licensed permanently in the state in which they are currently living, or are temporarily licensed. But a lot of private insurance panels are, covering telehealth, even going so far as to waive copays, at least temporarily. There are other also in-network kinds of options if you go through your insurance company, if you have it. If people are uninsured, there are also a lot of training clinics, which I'd be happy to provide, if anyone wants to kind of email afterwards, we can provide these kinds of local resources where there are always low fee, even local, even if it is temporarily telehealth, options for people if people want to have psychotherapy sessions. And then there are also online support groups. There are other kinds of mental health resources online if you just want to kind of do some reading or have other kinds of support. And so it's true, it is in some ways almost more accessible, all different kinds of support these days.
Yeah. Yes, and absolutely. Thankfully, we have the ability to make it accessible during these times. Well, so that's actually great information on ways that we can kind of focus on self-care and coping and reaching out for support for ourselves. So thank you both very much for your insights there. I think we'll kind of now transition and talk about how do we help kids, because in a lot of states, some states have already started schools. Some are going to be starting in a few weeks, and so obviously a lot of parents are concerned about this, and for a lot of different reasons. And so they're probably wondering what they can, how they can help their kids best right now. So I'm going to bring in Eileen to talk about, kids' mental health during this pandemic and as schools are reopening. So Eileen, I guess we'll start with, what are some of the things that parents can do to help kids cope with everything going on? And are there particular behaviors that we should, be looking out for?
Yeah, I mean, I think a lot of the information that we know about ourselves as adults really applies to children, obviously with different developmental expectations. But the kids are having a broad range of responses to this. Maybe the brief magic of being stuck at home has worn off at this point. And I think I really liked how Sharon phrased it, like, it doesn't need to be positivity all the time, right? The goal is not no sadness, no frustration, no anger, because that's a really natural reaction to all this. And especially for younger kids who might not be able to sort of process some of the information about why we're staying home, or really understand that, this is a scary situation, how they're keeping themselves safe. I think this is actually a bit of an opportunity to do a little bit of modeling of how to deal with negative emotions, right? So, we're seeing a lot of anxiety, a lot of anger, a lot of frustration, withdrawal, especially if they're limited social contexts. And for younger kids, doing some labeling of that, right? Like, oh, it looks like you're really frustrated. And if it seems like this is a skill that kids are really young for, or that they are struggling with, like, oh, I can tell because, like, when I get frustrated, my body feels hot, or I feel, my hands feel tense. And just to help label that, and that will set you up to be able to introduce some coping strategies if this is not a cycle sort of your child is doing on their own quite yet, which they might not have needed to before. So I think that's really good. I think the isolation piece is really hard, right? People are used to seeing their friends, especially during the summer. I know just in my neighborhood, purely anecdotally, the kids have found some really creative ways to let each other know that they're thinking of each other, leaving little notes. There's a lot of chalk messages. I know I have a friend with a 4-year-old. We're writing letters, which has been a lot of fun. We're drawing mazes for each other. And so I think there's, again, all these things take a little bit of extra energy, but finding some ways to replicate as much of the structures we had before as we can in the absence of those like real life experiences, which I know we're all missing, but especially kids.
Absolutely. Yeah, I know my kids have been using the Facebook Messenger for kids, which has allowed them to stay connected with their friends. So it is great that we have that to at least try to, so they can at least stay in touch with as many friends as they can right now. So, I guess, you mentioned kind of this difficulty with the isolation and this prolonged isolation, that's been going on for kids. What do we know, if anything, about, maybe some long-term effects this pandemic might be having on children's mental health and their social well-being?
Yeah, I think from a research perspective, this is a really interesting time because it's happening moment to moment, right? And so I have a background working with kids who have experienced trauma or traumatic stress, and I think the overlap between that sort of symptom profile is pretty similar to right now, right? So your routine has been changed suddenly. You're sort of seeking this sense of safety. I know I'm hearing from a lot of families, kids, they're headed back to school and all of a sudden their anxiety is really high, or their behaviors seem to be coming out of nowhere. And so I think that the long-term plans, do we specifically know how COVID impacts this? Not necessarily, but I think that some of the lessons from the traumatic stress area can be helpful, right? So things like creating a routine and sticking to it as much as you can. Recommendations like giving kids a really big heads up about changes or unexpected things happening, if you can. I mean, most of us are getting updates as they happen. And I think expecting that experiences from a kid's point of view might be interpreted a little bit differently, right? So going back to school, on the one hand, it might be really exciting because they're tired of being stuck at home. But that also, being out of a social situation for that long could be really challenging. So maybe having to reintroduce some of those skills and that mindset. I think maybe doing a little bit of like visualization or talking through what it might be like to go back to school could be really helpful for some kids, like, oh, you're going to, walk in the front door, and what teacher will be there waving at you? Okay, well, wave to them and create some sort of positive, recreating that positive experience that maybe they had before. Or then if they're at school, or not at school, if they're learning from home, what are you going to learn, or who are you going to see on Zoom, or what are we going to do at home? And I think that, using the skills that we can now and then sort of see long term, but I think just dealing with what is right in front of us is going to be sort of most important for best long term outcomes.
Mm-hmm. Yeah. And, we've kind of talked about this earlier about, thinking about COVID and this pandemic really is kind of traumatic. How do we talk to our kids about traumatic events, and how much, obviously I imagine depending on the age, right, in terms of how we approach that, but how much do we share with them about, what's going on with COVID? I think, a lot of parents struggle with that in terms of how much do I share? Do I not share? So any advice that you would have on that?
Yeah, I think this is the biggest question I get from parents about, like, where is the line? I always say figure out what they know first, right? So, what have you heard, right? Because maybe not 9 times out of 10, but I'll go with 8 times out of 10. There's a piece of information or a quote that they have heard that is maybe causing some anxiety or some worry, and then you can sort of get right to the root of it. I think giving enough information to be clear that you're being honest is important. Like there's a big pandemic going on and lots of people are getting sick, but following it up really quickly with sort of your safety protocol, right? But that's why we're wearing masks, and that's why we are not seeing our friends quite as much. So we can, stay here and keep yourself. So mom will be here to take care of you. And really reiterating, I think, that message about safety and you're being taken care of, and we have all sorts of people who have an eye on you, is a really good way to balance that conversation, especially for younger kids. And then with older kids, they can understand what's going on a little bit more, so you can maybe get into more details about, the science. We're learning new things every day, but what have you read, and like, what should we do about that? So more of a like a collaborative approach I really like to promote with adolescents in particular.
Mm-hmm. Great. Okay, that's definitely some great tips. And so I'm noticing a couple questions here in the Q&A around this theme of, dealing with people who may have different levels of comfort, right, around COVID in terms of, some people may be following the rules more than others, or having more restrictions in place than others. I guess we can extend that to kids as well. Like, what happens if parents have different comfort levels with their kids? Like, so-and-so's daddy, lets him play with kids outside, but then, but why can't I do that? So how do we kind of navigate that conversation with kids, especially the younger ones who may not really, understand some of the reasons for that?
Yeah, I think especially with the little ones, whatever language you already use to discuss family differences, we would just sort of insert again. So if there are different like holiday practices or religious practices, or other things people do in their yards or whatever, saying, oh, this is the way our family does it, and they're just doing differently, and trying, whether or not there's frustration or judgment, they're trying to minimize that and just focusing on, like, this is just how we do it, and it's just different for now. I think for older kids, especially when you're developing what your family rules are about, when people can go out or how they can go out, doing that again in like a collaborative way. So we can be like, okay, why is this important? And, we think we should only go out with masks, and, you seem to think something different. What is that? So that way, when you're faced with families doing something different, you've already had that conversation in a calmer moment, I think would be a good way to approach it. But it's tricky. It's, if you're watching someone out the window doing something fun and you're little, that's hard for all of us to sort of explain that away.
Sure. Yeah. Well, and I'll bring Sharon and Shara back into the conversation here, because just noticing a question that we have here about, we're thinking about kids, but also, we think kind of on this developmental lifespan perspective here, thinking about college students, and young adults. So we have a lot of, in addition to elementary, middle, high schools reopening, we have some colleges that are reopening, some that have already done so, some that are going to be doing so in the next few weeks here. So any tips that, any of you would have on helping, college students kind of, let's say as a parent, what can you do to helping, college students deal with, returning to college, or if they're having to quarantine for 2 weeks, dealing with that, any thoughts or advice or recommendations you would give to a parent or family member, or to, I guess, to a college student.
Yeah, I think in terms of the parents and the college students, I think it also all depends on whether or not they are particularly anxious, right? So I think that many college students can't wait to get back to school. They've had a summer, if not more, of living back in their parents' homes, of feeling especially isolated. I think that a number of college students, and also they're, within the age range or the demographic where they're not likely to have a very, severe case of COVID if they get it. So I think many college students are actually very excited to go back to school. As far as the parents, though, once again, I go back to what I was saying before about normal reactions to an abnormal situation. I would expect parents of returning college students to feel anxious. Luckily, they have access to their child through text, through FaceTime, through any number of technology that we have today. I think a number of colleges are implementing some pretty good safety guidelines. We were just talking about what Tufts is doing before we came on live. So I think that parents should expect to have some anxiety if their child is going back to school, but they may be assuaged in knowing some of the guidelines that the school has in place, as well as being in maybe more frequent contact with their child. The child might not be so thrilled about that, but it is certainly something that may be able to help parents who are likely going to be feeling more anxious if their child is in fact going back to campus.
Mm-hmm.
And I can add from that. I mean, I don't have college age children, but I'm teaching at a college. And so I think that something, I have advisees and I've been emailing to reach out and say, hey, let me know how you're doing, but to really encourage your students to use those resources. And I'm sure it's the same for Professor Crehan and Summers as well. But, we're here. I know on my end, like Tufts has been very communicative with me about how to best support students and making sure we have information about mental health resources so that their professors and advisors are probably pretty well prepared to send something if they need it. So to reach out, like now is the time to connect with those, especially if they're nervous about coming back to campus.
Right. And I might add, if I like also, Eileen mentioned when kids, including younger kids, have questions, kind of seeing where they're at first before kind of assuming what their experience is. So, there may, as Sharon mentions, that college students may be thrilled to get back, or maybe some students may, as Eileen brings up, have more distress about going back, or sort of how are they navigating the uncertainty of going back. So kind of, I think being very, like, keeping it real and seeing, what's it like for you that school's starting again, and how is it? Is it hybrid? Is it all remote? Is it in person? What's it like for them? Sort of just seeing where they're at and then validating their experiences. If they're feeling excited, or they're feeling anxious, it may be, as Sharon mentions, it may not match what the parent is experiencing. And so maybe we shouldn't sort of assume about college students' reactions, but rather see where they are, see how they're understanding it and conceptualizing this, and really just, validating what they're feeling, and absolutely encouraging seeking additional support if it's really kind of getting in the way.
Yeah, right. Well, speaking of family relationships, there's a question that we got here about, how do you, we've kind of talked about, well, one of the ways to cope is by relying on your family relationships and communicating and maintaining good social connections. But what if we have, part of the stress that people are having are those relationships, or more time just together in the house, is causing increased friction. What are some tips you would have for people how to kind of navigate these problematic or stressful relationships that they're experiencing right now?
So I can start. Yeah, that more time together can in fact result in more conflict or more difficulty. And that's a great question, and it's a very tough situation. I think that to the extent where it's possible, where the weather is still nice, I think spending time outside, getting physically away, being able to take a break from one's family, from the interactions. I think connecting with people beyond one's family, again, whether it's from a socially distant manner or through any of the online platforms, and also expecting that this type of situation will in fact or may potentially cause more conflict. It is very, very hard, and so it doesn't surprise me to hear that there are more instances of family conflict. Yeah, I think I'll let Shara take a stab at the question as well.
Sure. I mean, I think I keep running into this theme, whatever the stressor might be, this theme that the pandemic seems to amplify, what might already be going on. And so, some families are kind of maintain a certain homeostasis given a particular structure of interacting. So a family dynamic may work because they don't spend all their time together, right? And then they are spending all their time together, and that's absolutely, I think, to try to, this is hard. And obviously if it's getting into a, set of circumstances where this is really getting in the way of, it's causing really significant emotional distress, obviously the family can seek additional support too. But I think it's, important to, as Sharon mentioned, create healthy boundaries, to have clear communication as well. It's a tremendous amount of work, and just, everyone, I mean, wouldn't it be great if all of our family members could just read our minds and like, no, I'm not able to talk right now. And like, why did you think I could? Right. And, or I don't want to be with you right now. I need solitude. I need privacy, like teaching if they're, kids might need help with language around this, but I work with many adults who need help kind of creating language around, either I need privacy or, you need to sort of be yourself in a different hat, as Sharon mentions, like you might have other parts of yourself that are also important. And some of those might involve solitude, and some might involve like, taking kind of the extra work to have interactions with other people or engage in other things that are important to you in your life. But communication is really huge, very, easier said than done sometimes.
And I think sometimes trying to build on some of the, the positive relationship aspects that might be there, right? So certainly, if there are circumstances where it's, there's a lot of emotional distress, and the counseling route is helpful. But even if maybe we're in a place of distress or aren't currently, right? Like we weren't all designed to be with our partners and our children, and, perhaps older family members 24 hours a day, 7 days a week in the same very small radius.
Right.
And so what are ways that you can sort of meaningfully add in some positive experiences in a situation that doesn't seem that positive? And sometimes that can be by doing something different. Some like, playing a game you haven't played before, or something like, some families are doing sort of like gratitude journals, like, well, how's one way like your little brother helped you today, or even with your spouse, right? So these are tools and tricks that we use in couples counseling that you can use even if you're not, trying to be in a space where you're doing couples counseling, right? Just sort of do like maintenance on your relationship. So trying to dig around for the positive, even when it might be more challenging than normal circumstances.
Right. Maybe to build on that. Again, the idea that you're not at square one, like building on pleasant experiences together. Maybe, Sharon mentioned, are there creative, socially distant ways that some family members or the whole family can engage with another family? Often, we might be more, some families are at their best kind of interacting in a different context, interacting with a different family or another, other people, and building on having more pleasant experiences together, so then you can kind of gain some momentum there too.
And I guess just expanding beyond family, or thinking about other relationships, we had a great question about how do you deal with people, let's say maybe it could be within your family, but it could be friends or even people, that you're meeting, you're interacting with, in person, who maybe are, who have very different views of this than you do. Like, we've kind of talked a lot about, people experiencing anxiety, or anger about kind of where we're at with managing this, this disease. But I think, it is important to acknowledge that there are people who maybe kind of on the other side of the spectrum. You might have family members who say, well, this isn't really that big a deal. This is being overblown. Why do we need to wear masks? Things don't need to be shut down like this. And they may not be practicing a lot of the same social distancing or hygiene behaviors that that you may be doing. So I guess just how do you and this has often now become so political too in terms of with everything. So I'm just wondering, what are some tips on how people can navigate those stressful situations in their daily life?
Yeah, I think that's an excellent question. And I think it is something that I'm hearing so much about, both in my personal life as well as in my professional life. And that goes back to what I was saying before about there being so much more anger that is coming into the therapy sessions now than in the beginning. And I think it's a very difficult conversation if one decides to engage in it. And that's a big decision. Do I even want to engage in a conversation with somebody who is choosing to approach the pandemic from a very, very different ideological perspective than me? If one is going to engage in the conversation, I think it's so important to come from a place of empathy to which is hard, which is really trying to put yourself in that person's shoes, to try as much as possible to understand where they are coming from. Okay, so this family member or this friend thinks it's fine to walk around without a mask, or thinks it's fine to still go on the playground when the playground is closed. Again, if the conversation is going to happen, and maybe it's a better decision to not have the conversation, but if you decide to engage in it, then I think your best bet is to come from a place of empathy. Okay, let me try and understand, even though I don't agree, let me try and understand why it is that my brother or my friend or my neighbor is choosing to do this, and coming from a place as well where there isn't shaming. There's a lot of judgment going on right now on both sides. There's a lot of stigma and shaming. And I think that if a person decides to have the conversation about somebody else doing things so differently, then the only way to even have a potentially meaningful and successful conversation that doesn't quickly escalate is by coming from a place of empathy, where the effort is in trying to understand why and how this person thinks the way that they do. Otherwise, it escalates and it just becomes a conflict very quickly.
Yeah. Right. A lot of empathy, definitely something we could, I think, benefit as a society having more of these.
All of us, all of us, and very hard to have right now.
Yeah. Yes. Eileen, Shara, anything else either of you would add?
Sure. I mean, I guess this wasn't totally the question, but I think there is also, someone also in the, I don't know, we are not quite at the Q&A, but this is overlapping with, this question about, when other people are doing this, but I'm doing this, and some anxiety and questioning about, like, am I doing the right thing? Am I being too, kind of strict with my protocol or not strict enough? And really kind of, thinking through thoughtfully, if you are kind of, I guess, trying to have some confidence in the decisions that you're making, which feel right for your family and the way you see your part in the larger society. I mean, I think that's a large part for a lot of people, even if some family members may not be at high risk, they see their role as keeping, from a public health perspective, but others don't see it that way. And so I guess this is a little out of scope, but the question can sometimes, I think, lead to people questioning their own decisions, or or, I'm not sure if I'm doing the right thing. And I realize how that can, be go down quite a what if rabbit hole. And I think it's important just to sort of remind ourselves and be confident about how we're making these decisions, hopefully very thoughtfully and for valid reasons.
And that could change from day to day, I think is an important part of what both Sharon and Shara said, that it might be helpful for you one day to have this discussion or argument or whatever it turns out with someone who has these differing views with you, but some days it might be healthy to not, right? So really checking in with yourself and what you feel like you can tolerate that day. I know both like in the folks I've talked to, and then personally, some days I'm just like, I just can't talk about this for a single extra second, right? And that is something that you really need to be touching in with yourself pretty frequently to see if you have the bandwidth to take on these conversations.
Right. Well, all great points, and I'm just being mindful. I know we're now at 12:45, so this is obviously a topic we could talk about for quite much longer. And I know didn't get to all the questions that were asked by the audience, but I just wanted to, first of all, thank all our panelists for their time and their expertise today. Some really great tips on caring for yourself and thinking about some good and adaptive health, coping mechanisms. I think one resonating theme, both with, adults and, for your kids, is just to accept and validate the emotions that you're experiencing, that this is a very, you're having a normal reaction in an abnormal time, right? That this is a very, unprecedented and very difficult. And so just kind of being compassionate to yourself and others with how you're feeling. And I think some great tips about how to cope and how to help your kids cope and have some good conversations with them. And then also, how to navigate some of these maybe difficult relationships you may be having, in or outside of your family. And then, also, making a good, rationale for maybe times for when someone might want to seek professional help and some of the, the easily accessible avenues we have now with telehealth. So I just wanted to once again thank everyone for their time for today. Thank you to our audience for coming in and for your questions. And if that, we'll close today's program. So thank you all very much. And stay safe and healthy and well.